Hey guys, how are you? Yeah. So let's begin the class. In a while. Today we are having lower limb marathon part 3. It's also the final part of marathon. Right. So far we've done around 100 questions. So far, if I tell you, done 100 questions, waiting for the stream to go live. So I can see Jyoti Kumari has written a hi. I'm good, Jyoti. How are you? I'm good. I'm good. I'm good. I hope you're doing okay as well. Yeah. So, yeah, like I said, today we are doing lower limb MCQ Marathon Part 3. So what I mean here is that we are going to try and get the basic MCQs to get the basic concepts of lower limb, and today we are going to be doing another 50 questions. Question number 101 to question number 100. We've covered the questions 1 to 15 part 1, right? Questions 51 to 100 in part 2, and now we'll part 3. And let me tell you that the questions are not interrelated in any way, so you can just attempt this MCQ marathon, which is a live quiz. Is a live quiz irrespective of whether you have attempted the right. So welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, India's largest online learning platform. So where we are doing everything that is related to MBBS and specific for first professional and part of the faculty here for the first professional. Here you'll have the top educators, you'll have quality content, and you'll have a great learning experience that is good to you. First of all, about me, who am I? If you're wondering that, my name is Chetanya Mittal, right? And I'm currently pursuing EBS from All India Institute of Medical Sciences, that is AIMS New India's West, right? My rank in the name examination was 4. My rank in the JIPMER UG examination, all rank was 5, right? And I am currently waiting for COVID to end. So, and as you all know that these exams have been merged into the single entrance called as the NEET examination. And as far as NEET PG is concerned, you all know that NEET PG is being replaced by another exam called as the next examination. It will also be an exit exam for MBBS, and it will also be the entrance also, right? And it is said that it will be on the clinical pattern with a 10% age for pre and para clinical, right? Now let's start with lower limb MCQ Marathon Part 3. Before I move there, I have to tell you a little bit about the whole Unacademy platform since the video on YouTube. Alright. So first of all, what is Unacademy? Unacademy is an online platform, right? So basically it's a online classroom and you have to download this classroom from your Play Store. Go to the Play Store and download the say that I don't want to take a subscription. I'll watch the videos on YouTube, that's enough. But let me tell you, the entire content is not on YouTube. There is a lot of content that is there on the Unacademy Learning. So it is mandatory, it is must that you download the Unacademy Learning app. Go ahead and install it. 10 million users have already downloaded it, alright, and it is very small app. iOS पे obviously पड़ा होगा, but go ahead and install it. You will definitely not regret. Okay? So there are a lot of top educators teaching here. So these are ones for NEET PG. You can see that a lot of people have already started associating themselves dedicatedly with Unacademy, right? And as you can see that all us educators, we are making plus courses, make plus courses, and these are blocked courses, which means that you need a plus subscription to have access to them. For need have access to them, right? For example, if you want to learn about genetic and metabolic errors in pediatrics, course for that, right, which has 6 lessons. You can just go ahead and watch this course, and that will cover your topics here, right? Similarly, why I was telling you to download the app even if you don't purchase a plus subscription for these special classes. Special classes means that they are free of cost. They are free of cost. You don't need to have a subscription to them, and you keep getting an update that an educator that you are following is live for us, right? So here you can see that, for example, you want to know what were the questions in surgery in the May AIMS 2020 examination. You have a special class for that, and free of cost, you can get to know all those questions. So why do you want to miss out on something that can be useful, right? So that is about these special classes. Now, as far as test series are concerned, there are free mock tests on NEET PG 2020. There are this is another advantage of downloading the Unacademy learning app. And if you are a plus user, remember you will never run out of questions. Weekly mock test चल रहे हैं यहाँ पे, ठीक है? और weekly mock test में comprehensive आपका syllabus coverage होगा. Yeah, there are batch courses. There are part B is paraclinical. This is clinical, and these are clinical courses. Right? For clinical you have 30. For pre-clinical you have 16 courses. Paraclinical you have 14 courses and 4 batch courses. अब तो और बहुत ज्यादा हो गए, ये स्क्रीनशॉट तो पुराना है, राइट? ठीक है. Now why Unacademy or why online learning? Because Unacademy, India's largest online learning platform, assures you that you will have a flexible schedule. जब सीखना है तब सीखो. Alright, ऑडिट लेक्चर है, जितनी बार देखना है देखो. लैंग्वेज ऑफ योर चॉइस, इंग्लिश में सीखना है, हिंदी में सीखना है, रीजनल लैंग्वेज हो मलयालम तमिल को. Unlimited practice means the quizzes I just told you about, you can retake them as many times as you want. Similarly, here, like I've opened my YouTube live chat here. Unacademy के platform पे there is a live chat option. You can chat with the educator very freely. You don't have to worry about being judged. Normal classroom में हाथ खड़ा करना पड़ता है, यहाँ पे कुछ नहीं, right? And then you have the option for interactive polls. ठीक है, so today's class will be a complete interactive poll class. I will be asking you each and every question, and simply you will have to just pick your preferred option. Okay? And learn anytime where you want. Cool. So last thing that I have to tell you about is the Unacademy Plus and the Unacademy Iconic subscription. Two things. What is Unacademy Plus? Where you get the to unlock a lot of features. Okay. Here you are getting access to live classes which are apart from the classes, live tests and quizzes which are apart from the free mock tests. Then you get access to batch courses. There are 4 batch courses here. Okay, जो उसमें screenshot में दिखाए थे जैसे. And then you have a structured schedule, right? So you can go ahead and select plus for your preparation. इसके अलावा जो which I will recommend to you, the Iconic subscription. Iconic subscription, the advantage is get Unacademy plus Prep Ladder. ठीक है? Unacademy is already India's largest online learning platform, and Prep Ladder इतना established है medical education. There are so many good teachers here. For pharma you have GRG sir. For ortho you have Apu Mehra sir, right? And these people, they are already teaching there, and Unacademy has acquired Prep Ladder. तो बात का पूरा advantage उठाओ. ये discounted price पे मिल रहा है ये obviously. में ये सारे प्लस वाले बेनिफिट्स तो थे. एंड यहाँ पे फॉर प्रेप लैडर you get their entire video lectures, their entire question bank, their handwritten notes are included, which are otherwise worth separately for 6500, and their rapid revision courses also. Go ahead, select Iconic, and this is the subscription plans for Iconic. Good part about Iconic is that you can take it in 1 year, 2 year and 3 year directly, और 1.5 year का भी है बीच में. You are, let's say, the final year and you are to give it in the after the, or बीच में कहीं पे हो. ये अब उसके बाद मजेदार चीज ये है कि हर सब्सक्रिप्शन पे 10% डिस्काउंट अनअकैडमी गारंटी करती है, राइट? 10% डिस्काउंट इज गारंटी, एंड दैट डिस्काउंट इज गारंटीड विद दिस रेफरल कोड. व्हाट इज द रेफरल कोड दैट यू हैव टू यूज? CHETANY, दैट इज माय नेम. बस 10% मिलेगा, मैक्स 10% लगा, 10, right? And what is the 10% discount you get? You can see here that the cost, instantly you get a discount. Cashback नहीं है, instant discount है, right? So here you can see this was 92,000. You got a discount of 9,200. If you are in the if you are in the second year, so the next examination will be at the end of the final year. You can go ahead and take this course, right? You can go ahead and take the course, and here you are getting both Unacademy Plus. Okay. Besides that, if you use my referral code, I'll tell you how to use credits, and I will give you a hefty cashback from my end. Okay, मेरी तरफ से आपको आपके अकाउंट में पैसे आएंगे पेटीएम से या यूपीआई से, राइट? And how do you contact me for that? My Instagram ID is @sandhya.blue. You can just write to me there that you want to take a plus subscription. And my Telegram channel is @NEET PG. Contact me on the discussion group. Right? These are the two ways to contact me. And once you contact me, I will tell you how to take the plus. I will tell you everything about it. I will guide you also if you want. Credits के बारे में बता दूंगा, इस cashback के बारे में बता दूंगा. And this is not just for the NEET iconic subscription, for any subscription. Even if it is a UPSC subscription for your brother, or an IIT subscription for your brother, or a NEET UG subscription for you, right? Any kind of subscription, right? And these are the plans for Unacademy Plus. Here you can give Unacademy Plus a trial. A trial अगर लेना है, so try to take the 3 month plan, alright? And after the discount, it will be around 10,000 for you in my cashback also. So here you can see that otherwise 1 year plan, year plan or 3 year plan तो यहाँ पे भी है. Same you have to use same referral code for any course that anyone that you know buys. This is the referral code, right? Hello. That's enough about this pitch. Let's move on to questions. Question number 101. All of the following contain the stability of the ankle joint except. Question number 101. Aditi, हाँ थोड़ा मतलब काम चल रहा है. Right. So Jayansh Vijay has given an answer here, and it is a pretty easy answer also. The answer here is going to be cruciate ligament. The answer is going to be cruciate ligament. So you all know that cruciate ligament is part of the knee. Cruciate ligaments, they are responsible for the anterior and the posterior cruciate ligaments. So very easy answer. Ankle joint की बात हो रही है, ये cruciate ligament तो knee में. This is going to be okay, no doubt about it. Kanya has also given. Question number 102. What is the medial most femoral? Medial most in the femoral triangle. So what are the contents of the femoral triangle? Just think about those. It's very easy answer. So Jayansh has said that the answer is B. Kanya has said that the answer is right. Even Bala has said that the answer is A. He has said that. So let me just tell you, A is the wrong answer. ठीक है? So the correct answer is lymph. ठीक है? तो आप ठीक सोच रहे थे. देखो, the arrangement is nerve, artery, vein, nerve, artery, but medial to it, you also have the lymph node. You also have the lymph node. So the lymph node option में है. So most appropriate answer is lymph node. Lymph node is in the option. Utsav Singh and Dr. Nitu have written the right answer. Lymph node is the option. You can see here femoral triangle, ये रही boundaries. आगे आपकी इधर sartorius रन कर रही है, इधर पीछे फ्लोर में डक्टर लॉन्गस पेक्टिनियस है, सामने inguinal ligament है. So you can see here nerve, artery, vein, and here you are the lymphatics. Remember, the lymph node is the content of the femoral canal. Lymph node is the content of the femoral canal. So the answer is going to be medial most structure is lymph node. Structure is going to be. Question number 103. Yes, medius is supplied by. Now supplied to gluteus. Bench has said, Bala has said, Sukar said. I'm getting the same answer. Yash Jain has given a different answer, that is inferior gluteal. ठीक है, इसी बात पे बता दो, which is the muscle that is supplied by inferior gluteal nerve? Yash Jain, can you answer which are the muscles which are supplied by inferior gluteal nerve? Can you name all the muscles supplied by inferior gluteal. All the muscles which are supplied by inferior gluteal nerve. जल्दी 1 सेकंड का आंसर है. Okay, ये तो obvious है. Nerve to obturator internus and nerve to quadratus femoris, they will supply their respective muscles. इनके तो नाम में ही है. So this gets eliminated, right? C and D नहीं होंगे. Inferior gluteal nerve, remember, only supplies single muscle, that is gluteus maximus, right? Gluteus maximus is innervated by inferior gluteal nerve and it keeps the entire nerve to itself. Share नहीं करता है वो nerve. Superior gluteal nerve is the correct answer, and very important because this is damaged, and then you will have Trendelenburg sign positive. It supplies gluteus medius, gluteus minimus, and tensor fascia lata. Alright, supplies gluteus medius, minimus, and tensor fascia lata. Question number 104. Which of the following tendons passes below the sustentaculum telae? The following muscles passes below the sustentaculum telae. It is part of the talus bone. It is a prominence. Talus bone. There is a shelf kind of a thing here, that is sustentaculum. Vijay has said that the answer is Bala Morgan and Sukanya. 3 people have answered. The answer is D. That's absolutely right. Right. The answer is flexor hallucis. Now you must know that the sustentaculum telae has two surfaces, an inferior and a superior surface. It has a superior surface and it has an inferior surface. Superior surface is concave. Right? Superior surface is concave, and the inferior surface, it has a groove or flexor. The question is based on the fact there is a groove for flexor hallucis longus on the telae. I've also kept a diagram here. You can see here. This is the tarsal tunnel, flexor retinaculum. This shelf here that you can see, reticulum telae. Below it is running the flexor hallucis longus. Below it you have the flexor hallucis longus running, and hallucis, some attachment on this here. Okay. On the inferior surface here, there is a groove, flexor hallucis. Okay. So question number 105. Which of the following tendons has attachments on? So basically, remember the flexor hallucis longus, it does not attach, it just allows the tendon to pass through. Question: passes below the sustentaculum telae. Ange and Misty have answered as option B, is tibialis posterior. Right? Answer is absolutely correct. No, no. Flexor hallucis longus, I just told you, does not attach. No attachment on sustentaculum telae. It's just a groove through which it passes. Right? It runs in that groove rather than per se attaching to the sustentaculum. Not have a insertion on the sustentaculum. Right? Here one thing. So flexor hallucis longus obviously has to go to the great toe, so it will not attach here. There's no sense of it attaching on the sustentaculum telae. Now I have one question for you. One question, please tell me the answer. The answer for 105 is option B, is tibialis posterior. Tell me one thing. This is a bonus question. want you guys to answer this. Tentaculum telae is a part of, thank you Aditi, which bone? Right. Your options are, first option is obviously calcaneus. Second option is talus. Third option is navicular. Fourth option is void. Fifth option is uniform medial. Sixth, what is your answer? You have seven options here. What is going to be your answer for the bone? The tentaculum telae is part of which bone? Gayansh Vijay has written calcaneum. The fast answer, calcaneum. He has also written calcaneum. Kanna has written talus. Pala has written calcaneum. Yeah. So the correct answer here is going to be, calcaneum. Right? Why the answer is calcaneum? This is tentaculum telae. It has the attachment of tibialis posterior. It has the attachment of tibialis. How you can remember this fact is that the talus bone, it does not have any muscular attachment. The talus bone, it does not have any muscular attachment. So if the tentaculum telae, if it's a part of the talus bone, it cannot have the attachment of tibialis posterior. Since this tentaculum telae has part of is having attachment of the tibialis posterior, it cannot be part of the talus bone because we know that the talus bone does not have any muscular attachment, so it has to be part of the calcaneum. Then it articulates there with the talus bone, right? That is why it is called tentaculum telae. Question number 106. Foot drop results as a result of injury. Foot drop results as a result of injury. So which nerve will be damaged for foot drop? Already told you this many times. Jayansh Vijay is usually giving the fastest answers. Can anybody beat his speed? Jayansh Vijay सबसे तेज आंसर दे रहा है. दे दनादन ये आंसर दे दिया है 106 का. एक और आंसर आ जाए बस. पूजा मिश्रा. The answer is going to be option A, deep peroneal nerve. The answer is going to be deep peroneal nerve. Remember, common peroneal nerve में भी हो जाए तो भी foot drop हो जाता है because deep peroneal nerve is a branch of the common peroneal nerve. Right? So common peroneal nerve, deep peroneal nerve का damage होता है. So there is loss of extensor. Extensors जो है हमारे foot के की हालत खराब हो जाती है, पैरालाइज हो जाते हैं ये नाक की तरफ. फिर उसको. Question number 107. Which of the following forms a tendinous sling in the lateral arch of the foot? Tendinous sling, the lateral arch. Okay, there are two tendinous slings. One is the tendinous sling in the medial arch, the tendinous sling in the lateral arch. जल्दी बताओ यार इसका आंसर. So guys, answer fast, fast. All right. Mr. said peroneus longus, and that's true. So tendinous sling is basically here formed by the muscles for eversion. Formed here by the muscles for eversion. Right? That is the peroneus longus, the peroneus brevis. For the medial arch, tendinous sling for the medial arch is formed by tendinous sling for medial arch. Please tell me tendinous sling for medial arch. Be formed by muscles for inversion. Will be formed for muscles for inversion. It will be supported by the tendons of tibialis posterior, especially, right? Question number 108. Features seen in common peroneal nerve injury. What are the features that are seen in common peroneal nerve injury? Right heart, tibialis anterior and tibialis, or medial arch. Tibialis and flexor long. Come to question number 108. Let's leave the medial arch. So there are some points of differentiation that you need to know. Know the d by dx of, what is d by dx? It is the points of differences between vertical and longitude. The longitude, longitudinal arch. Question number 108. Yes. No. T is obviously their common peroneal nerve, like I told you. You have superficial peroneal nerve and you have deep peroneal nerve, right? And since they will supply the superficial peroneal nerve, what it also does it supplies? It supplies, here you will have loss of tension, loss of extension of the foot because tibialis anterior is gone. So you will have foot drop. And there is loss of eversion. There is loss of eversion because they also supply the peroneus longus and peroneus brevis. Loss of eversion is gone. So inversion inability is wrong. It should have been eversion inability. It should have been eversion inability. There won't be loss of sensation of the sole much because the tibial nerve is the main nerve that will supply there, because the medial and the lateral plantar nerves are still intact. Will be loss of extension of the great toe. Yes, that's true. Loss of extension of great toe because flexor, the extensor hallucis longus, and then going to be there. Then it will be fibular neck. Yes, so the common peroneal nerve, it is found at the level of the fibular neck. It is very superficial. Common peroneal nerve, it can be rolled around the fibular neck. Yeah. So another name for common peroneal nerve is common fibular nerve, right? Peroneal can be replaced with fibular. Wherever you see peroneal, you can replace it with fibular. Common fibular nerve. So it is in near the neck of the fibula bone, right? Question number 109. Arterial supply to the head and neck of femur. Main arterial supply to the head and neck of femur. Main arterial supply. There are two options here that do supply the head and neck of the femur. One is the lateral circumflex femoral artery. Second is the medial circumflex femoral artery. So both are going to be correct. Although the dominant supply comes from the medial circumflex artery, but I will give right A and B. Dominant supply, however, it comes, remember, from the Medial circumflex femoral artery. The answer is here. Write the answer. Write the answer is greater than or something. Question number 110. What is the root value of the posterior cutaneous nerve of the thigh? You should definitely remember this. What is the root value of the posterior cutaneous? Sometimes it is written as posterior cutaneous femoral nerve. Right? It's the same. Tell about the root. Kanya has answered already for 110 that the answer is S1, S3. That's absolutely correct. I think I've kept a figure. The lumbosacral plexus, mainly the sacral plexus is coming from the plexus of 1, S2, the contribution S1 going, S2, other here, oral, cutaneous. Question number 111. Extensor hallucis longus is supplied by extensor hallucis nerve supply to extensor hallucis longus. Right. The extensor hallucis longus it is supplied by the deep peroneal nerve. That's true. Extensor hallucis longus is supplied by the peroneal nerve. The deep peroneal nerve, first of all, it is damaged in case of foot drop. It is damaged in case of foot drop. So remember during foot drop what happens? So that is how you can remember that the deep peroneal nerve it supplies the anterior compartment of the leg. Anterior compartment of the leg. Anterior compartment of the leg is for the extensor compartment. So the answer is not C. The answer is option. The answer is option B. Extensor compartment. So it also has the leg, a long extension. Question number 112. Anterior compartment of the leg contains all except anterior compartment of the leg. It will contain all of the muscles except. The word here is except. Right? Very careful. Right. So anterior compartment of the leg contains all except peroneus brevis. Why? Because peroneus brevis is a muscle of which compartment? Can you tell to which compartment does peroneus brevis belong? Compartment does peroneus brevis belong? Lateral compartment. Peroneus brevis and peroneus longus they belong to lateral compartment. So what is the nerve for the lateral compartment? It is the superficial peroneal nerve. And what is the nerve for the anterior compartment? The peroneal nerve. Okay, so that's one thing that you should remember. Right? Question number 103. Nutrient artery to the femur. Nutrient artery to the femur, it arises from which of these arteries? It's not an issue, Karanveer Singh Rathore. You can see the video from the beginning. Right? So somebody's answered profunda femoris, somebody's answered femoral artery. The correct answer is profunda femoris. He has written detailed explanation. The second perforating branch of the profunda femoris. And I had forgotten this point. Right? Perforating branch of. Next question. Previous question was nutrient artery to femur. Now this is nutrient artery to fibula. Artery to fibula arises. So okay, Mishti has answered C. Posterior tibial artery. He has answered. The answer is C. Please note यहाँ पे क्या लिखा है. यहाँ लिखा है 50. पोस्टीरियर टिबियल आर्टरी जो आंसर है ना गलत है. रॉन्ग आंसर. टिबियल कैसे होगी यार अगर फिबुला को सप्लाई करना है. The answer is peroneal artery. The correct answer is peroneal artery. Right. So now, since you don't get confused, a small summarization on arteries. For the long bone. Had femur, have tibia, had टिबिया का क्वेश्चन किया था तो क्या बोला था. सेकंड परफोरेटिंग ब्रांच ऑफ profunda femoris artery. Right? Yeah, you have the here here क्या आती है. Right? It comes from the peroneal artery. Right? Keep this summarization in mind for the new. Question number 150. Force of the great saphenous lies in what relation to the malleoli? Force of the great saphenous. Karanveer Singh Rathwar has given an answer. Anterior to the medial malleolus. That's the correct answer. That's absolutely correct. So there's one point of difference here that you have to remember, right? That specified a lot of times is point of difference between great saphenous vein and small saphenous vein. क्लास ले रहा हूँ बाद में बात करता हूँ. There is a passes anterior to the tibial or the medial malleolus, and this passes posterior to the lateral malleolus. एक ये point of difference होता है इनके बीच that you have to remember. There are other points of differences in the great saphenous and small saphenous vein. You can also remember that there's a table drawn in your BD. Question number 116. All are contents of the femoral sheath except. Very easy question. Contents of the femoral sheath. So the following is not a content of the femoral sheath, and it is a very important point जो हर हालत में याद होना चाहिए. Femoral nerve. Don't you think that the answer should be genitofemoral nerve? ये तो सब femoral है. तो आंसर तो ऑप्शन डी नहीं होना चाहिए. फजल अख्तर, करणवीर सिंह राठौर को भी बता. ठीक है, तो आंसर बी होगा. तो कंटेंट्स एक बार रिवाइज करने हैं आपने. ठीक है, 2 मिनट में करा देता हूँ. चलो कि ये बनाओ पहले. 3 कंपार्टमेंट करो. मीडियल, इंटरमीडिएट, लैटरल. लैटरल कंपार्टमेंट एकदम निकम्मा. इसमें क्या है? लिम्फ नोड ऑफ ग्लॉकेट या रोजनमुलर. ठीक है, नाम इंपॉर्टेंट नहीं है, बस लिम्फ नोड है, ये इंपॉर्टेंट. ठीक है, नाम इंपॉर्टेंट नहीं है, लिम्फ नोड है, ये बात इंपॉर्टेंट. यहाँ पे क्या बनेगा? वेन. दिस मोरल वेन यहाँ पे बनाओ. आप यहाँ पे बनाओ मोरल आर्टरी. साथ में सबसे जो मीडियल कंपार्टमेंट है इसमें एक नर्व जाती है. नर्व का नाम तो अब पता चल ही गया है क्या है. नर्व जाती है वो है जेनाइटोफेमोरल. फेमोरल ब्रांच आता है यहाँ से, फेमोरल ब्रांच ऑफ. So those are the contents of the femoral sheath. Question number 117. Conjoint tendon is formed by. Joint tendon is formed. Right. Misty has said that answer for question number 117 is C. Internal oblique and transversus. Right, 117 going to be options. Internal oblique and transversus. So this is the conjoint tendon. This is the conjoint tendon, and it combines the insertion of the transversus abdominis and the internal oblique muscles, the pubic crest and line. ठीक है, ये देखो, ये तुम्हारा रहा ट्रांसवर्सस abdominis, ये रहा oblique conjoint tendon diagram. Question number 118. Major function of the gluteus and minimus at the hip joint. What is the major function of the gluteus? Yes, gluteus minimus have the same function the hip joint. ये बताओ यार, this medius and minimus, they are mainly going to be right. Mishti has answered correctly. They are mainly having the function. Ranveer Singh Rathore is sure that the answer is main function is abduction, and you can see medial rotation. So our option में common है. They have two functions. Main, they are abductors. They are powerful. Value of sciatic nerves. छोटी ताजी nerve है. This is option B. L4, L5, S1, S2, S2. Sciatic nerve is the thickest nerve. Sciatic nerve is the thickest nerve in the body. Right? तो obviously अब 5 रूट वैल्यूज तो मिनिमम होंगी. ठीक है, कि 5 तो कुछ नहीं होता, 5 तो रेडियल नर्व में भी होता है, नर्व में भी होता है. These are the 5 root values here. 109. Question number 120. Safe site of injection in the gluteus maximus. हाँ देते हैं injection gluteus maximus में, that you should know, and the reason for that also. E, superior lateral. That's true. The answer is superior lateral. Now, why is it given in the superior lateral region, upper outer quadrant? Yes, that's true. Because this is the region where there are no structures. All right. So your maximus, you have drawn the bump. If I divide it into 4 quadrants, this is the lateral quadrant. In the inferior medial quadrant, here somewhere here you have the sciatic nerve path. Where here you have the sciatic nerve path. You don't want to injure the sciatic nerve. Stay as far as possible from the sciatic nerve, as there are a few structures here and here as well. Safest quadrant here is the superior lateral. Also remember the deltoid muscle जो होती है, उसमें what is the quadrant in which the deltoid muscle, which quadrant is the injection given? Where do you give the muscle in the deltoid? Deltoid में it's basically not because of the quadrants, it is because of the acromion process here. यहाँ पे होता है acromion process, okay? And you basically take 2 fingers below the acromion, fingers below the acromion, the injection. The reason for that is the axillary nerve. You have to save the axillary nerve. That is what you have to be careful about. So when you're talking about gluteus maximus, which nerve you have to preserve? Sciatic nerve you have to be careful about. When you're talking about deltoid, you have to think about axillary nerve. Alright? Question number 121. Major flexor of the hip joint. major flexor of the hip joint. Right, so absolutely true. Major flexor of the hip joint is psoas major. Its function itself is flexion. Question number 122. Trendelenburg sign is due to the paralysis. Again, a very easy question. 1 second answer for Trendelenburg sign. Iliopsoas are the G flexor. Right. So Trendelenburg sign, gluteus, medius. No doubt about it. Question number 123. Question number 123. Inguinal ligament forms the boundaries. Inguinal ligament will form the boundaries of which triangle? Tim Kumara said that the answer is Hasselbalch's triangle, right? And even Mishti is saying C. Alright. Here, the answer is going to be Karanveer Singh Rathore is also saying you don't know the boundaries of the femoral triangle also. Answer is C option, that is both inguinal ligament. It forms the one of the boundaries for the femoral triangle. First of all, it does, yes, this forms the boundary for the triangle, inguinal ligament. And मेरे को लगा था inguinal ligament और femoral triangle तो सबको पता होगा. I didn't keep for boundaries of the femoral triangle boundaries. Here you can see here that inguinal ligament is forming the base of the femoral triangle. Inguinal ligament forms the base of the femoral triangle. This entire thing is the triangle, and with adductor longus is so the inguinal ligament, it forms the base of the. That's all you need to know here. Inguinal ligament forms the base. For Hasselbalch triangle, it again forms the base. Right? How? Look here. The inguinal triangle or the Hasselbalch triangle border, this medial border, it is formed by the rectus abdominis. Lateral border is by the inferior epigastric vessels. The base is formed by the spinal ligament. SL back strike. Question number 124, length of the inguinal canal. क्या तुक्का मार लो, बहुत कोई लॉजिक तो है नहीं. फैक्ट 5 सेकंड्स में मैं आंसर बता देता हूँ. 1 2 3 4 5. The correct answer is option 4 centimeter. Option probably no. Again, not a very important. Let's move on. Question number 125. Deltoid ligament is attached to what except. वन ट्वेंटी फोर स्किप कर दो यार. 124 बेकार क्वेश्चन. 25 पे आ जाओ. Right, so deltoid ligament is attached to all except 125. The answer is option D, that is lateral malleolus. Answer is lateral malleolus. Deltoid ligament, either it can be attached to medial or it can be attached to lateral. And these are part of the medial longitudinal. Deltoid ligament is one of the supports of the medial longitudinal arch also. It is attached to the medial malleolus and it is not attached to the lateral malleolus. Question number 126. Flexor of the hip joint are all except. Flexors of the hip joint are all. Right. Gluteus maximus, it is a very powerful extensor. It's the tensor of the hip. Right. Present posteriorly, it has to be an extensor of the hip. Rest of these, they are flexors. Psoas, iliopsoas is the main flexor. Sartorius and rectus femoris can also act as. You have tibial nerve, which nerve is which muscle is not supplied by the tibial. This is tensor. Answer is option C, peroneus longus. Option C, peroneus. Because it is peroneus. I already told you it is, you can replace it by fibula. Replaced by the word fibula. The tibial nerve obviously, right? It is supplied by the superficial peroneal. The rest are muscles that are supplied, which are present posteriorly, so they will be supplied by the tibial nerve, plantaris, gastrocnemius, and question number 128. So the following ligaments is derived from the tendon of semimembranous. Of the following ligaments is derived from the T is innervated by the superficial peroneal nerve, not by the common peroneal nerve, innervated by the superficial. Let me just check. Brevis is definitely innervated by that. These are muscles. Peroneus longus and peroneus brevis, they belong to the lateral. Tibial nerve, it does not lie the lateral, lying the lateral. Right? For here on question number 128, Kiran Kumar has given the answer. He has given the answer. So the following ligaments is derived from the semimembranous tendon से peak popliteal ligament. बार बार आ चुका है ये question. And again tell you the same thing. Question if it is that semitendinosus से आता है कि semimembranosus से आता है. Just apply this logic. That semimembranosus means half muscle, half tendon. Tendon cannot. Tendon is very different from a ligament. ठीक है, एक white connective tissue है, एक yellow connective tissue. Ligament हम semitendinosus से नहीं लेंगे, semimembranous. और वो ligament कौन सा है? Oblique. Both of these muscles, they are hamstring. They are hamstring. Yeah. Number 129. So yeah, there was a question here. Here seen in common peroneal nerve injury. One of the features that was seen here was that we saw was to drop, loss of extension of great toe and filler neck. It is in the filler neck. So now let's come back. Common peroneal nerve can be rolled against of the following part of the. Again, for here, now you can make out that what the answer is going to be. Common peroneal nerves are associated to the neck of, that is the region where common peroneal nerve can be rolled up again. So it can be palpated. Try to move your finger on the neck of the fibula, you will be able to feel that there is a nerve that is being rolled over. Right? 129. Question number 130. Following tarsal bone devoid of muscle. The answer is Ranveer Singh Rathore has said the answer is no, 130th is not B. I've just told you this in today's class only. In today's class, asked you a bonus question, remember? Asked you a bonus question. I told you the answer to this question. What was the question that I asked you? You remember the bonus question? Right. So Kiran Kumar has given the right answer, talus. So the question that I had asked you was related to the tentacle villi. It is a part of the calcaneum bone. Right. So talus bone, it is a bone that is devoid, completely devoid of muscular attachment. Yeah. That is one important thing that you have to. For example, if in your Viva they ask you that tell me the attachments of muscular attachments of the talus bone, right? Then you have to immediately say tarsal. The talus bone is the only tarsal bone that is devoid of attachment, right? Immediately say that, and that will save your day, right? And the examiner will be very impressed. Otherwise, start thinking about the attachments. That is going to be a little tricky for you. You definitely say some muscle. That will be obviously wrong because there is no muscle that attaches here on the talus bone. That's very important for your Viva. Tarsal bone, talus is devoid of. Number 131. On charging, yesterday as well, regarding the spring ligament. That's true that it is synonymous with plantar calcaneonavicular. Option A is true. It is synonymous with spring ligament. It is synonymous with plantar calcaneonavicular ligament. Question number 132. Skin of the dorsum of the first web space of the foot. Right by. 131, the answer was A, right? Amit Kumar Das is also right. For 132, Karanveer Singh Rathore is right. The answer is option C, peroneal nerve. Supplies dorsum of the first web space. What about the rest web spaces? What about second, third, fourth web space? They're supplied by which nerve? They are supplied here by the superficial peroneal nerve, and the first web space is supplied by the peroneal nerve. For it to- So you can just place this picture with peroneal. Now you'll be able to make out that the nerve supply mostly here is through the superficial nerve, and but this deep fibular nerve it supplies the dorsum of the first. The second, third, fourth they are supplied by the super. Question number 133, true about the adductor hiatus. The answer is option D, all the above. True about the adductor hiatus. Right. The opening is the aponeurosis of adductor magnus. It lies close to the adductor digital and important. All of these are true. Kiran Kumar is right. The answer is all of the right. Question number 134. जल्दी बताओ आंसर चार ही तो ऑप्शन है आर्टिकुलरिस जेनो तो ये डायग्राम देख के बता दो अब दिस डायग्राम एंड देन टेल मी द आंसर जल्दी ऑप्शन right? So out of these, you can see the article aris genu, closely related to the vastus. Yes, closely related to the vastus. Yes, so the answer is 134. The answer is vastus. Show you the diagram also. Question number 135. An easy question now. Be answering this. Anterior-posterior stability of the knee. So remember, you have two ligaments. One is anterior, one is posterior. कौन से ligaments थे वो? So the two ligaments. One was anterior, one was posterior. Right. Cruciate ligaments. One was anterior cruciate ligament, one was prevented anterior and posterior dislocation of the tibia and the right. They prevented the anterior and the posterior dislocation of the tibia and the. So question number 136. The most stable position for the ankle. Most stable. Yeah, I told you a logic also here. I told you a trick also here. How do you remember this? एक काइंड ऑफ mnemonic सा था. Mnemonic भी नहीं कहूंगा मैं उसको. I'll I'd call it a correlation. I had told you how to remember the most unstable position. का उल्टा होगा most unstable position याद करवाई थी. Very easy to remember. Most unstable position. Right. So most stable position for the ankle joint is in dorsiflexion. In dorsiflexion. Right. Because most unstable position I told you is पे लड़कियां heels पहनती हैं. Heels वाली position. क्या होता है? Heel is raised and this is the toe. This plantar flexion. This plantar flexion. This is very unstable. This is the highly unstable position. This is very stressful for your ankle joint. The most stable position is its opposite position. Plantar flexion का opposite क्या है? Dorsiflexion. The most stable position is dorsiflexion. Right? Most stable position is dorsiflexion. Question number 137. Structures passing through sciatic foramen. Structures passing through sciatic foramen. mnemonic भी बताया था. लास्ट क्लास में एक अच्छी सी सेक्सी सी स्लाइड बनाई थी. right? Inner gluteal nerves and so remember the structure were pins in, and these were the ones that were entering. They're going to the lower limb. So question number 138: structure which passes through both greater and lesser sciatic foramen. पिन में याद है ना कौन से स्ट्रक्चर्स क्या थे? कल ही निमोनिक बताया है यार, दोबारा रिपीट करना. Were re-entering and these were going to the lower limb. So what was PIN here? This was pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Right. So Mishti has applied some brain that if it passes through both greater and lesser sciatic foramen, it must be a structure that is re-entering. Because what these structures do is they exit from the greater sciatic and they re-enter from the lesser sciatic foramen. They will be passing through both greater and lesser sciatic foramen. The answer here has to be either pudendal nerve, not in the option, internal pudendal artery, not in the option, nerve to obturator internus is in the option. So the answer is option C. Yeah, so these pin structure are in the entering ones, right? Question number 139. All are true about the popliteal fossa except. All are true about the popliteal fossa except. And a similar question previously also. On your diagram also, he has given the answer as B. So popliteal fossa is bounded above by tendons of the hamstring. Yes, semimembranosus, semitendinosus, biceps, सब होते हैं. Below by two heads of the gastrocnemius. Yes, medial and lateral head. That is why it is the diamond shape. Deepest structure is the popliteal artery. That's absolutely true. I've shown you this diagram as well. Popliteal and femoral vessels are continuous through the adductor hiatus. Yes. Femoral vessels, adductor hiatus से जैसे ही बाहर निकलती है वो popliteal हो जाती है. So femoral artery becomes popliteal artery. Femoral vein becomes popliteal veins. Popliteal vein becomes femoral vein. Right? Common peroneal nerve passes superficially through the central portion. No, this is false. It passes along the lateral border. It passes along the lateral border. Through the central portion, you have the tibial nerve. Through the central portion, you have the tibial nerve, which is right, not the common peroneal nerve. Common peroneal nerve goes along the lateral border of the popliteal. Right? Kiran Kumar, the answer is not C. The answer is right. This central portion is wrong. That is the problem here. Having the lateral portion. Or if it had to be a central portion, that should have been the tibial nerve. That should have been the tibial nerve. Question number 142 about the anatomy of the great saphenous. ends in femoral vein. Yeah, that's true about nerve. So it starts as a continuation of the medial marginal vein. All right, there are 10 to 20 valves below the knee. It's not 2 to 5, and it ascends for 2 to 2.5 to 3 centimeter, not behind the malleolus, but in front of the malleolus. But in front of the malleolus, in front, right? So those are the three corrections that are there, and these are the kinds of differences that are going to be there between the great saphenous vein and the small saphenous vein, right? Question number 141, which is the muscle which is attached to the navicular tuberosity. So, what is the muscle that is attached to the navicular tuberosity? Quick answer. So, remember, I had told you that there is a muscle. There is a muscle that attaches to all tarsal bones. It attaches to all tarsal bones except the talus. Except the talus. Which was that muscle? That is this is the first point. Second point is there is only one muscle. There is only one muscle that is attached to navicular bone. 2 points. And now, if you know the answer to any of these questions, you will know the answer to the other. You know the answer to this question, you know the answer to this question, you know the answer to this question, you know the answer to this. Because they are possible only in that way. The answer is tibialis posterior. That's absolutely correct. So tibialis posterior is the only muscle here that is attached to all tarsal bones except talus, and tibialis posterior is the only muscle that is attached to the navicular bone. There is only one muscle that attaches to the navicular bone, and that is tibialis. The true about femoral nerve are all except. This is not true about the femoral nerve. So 142, you know the root. What is so it lies outside the femoral sheath. Yeah, we've already discussed this. It has the largest cutaneous branch, which is the saphenous nerve. The largest cutaneous branch of the femoral nerve is the saphenous nerve. It does supply the quadriceps femoris, right? Now what is left is the root values. So the root values for this are L2 to L2, L3, L4. L5 is not included in the femoral nerve, right? Similarly, this is also the root values for obturate. Question number 143, all are contents of the femoral triangle except. All are contents of the femoral triangle except. The correct answer here is okay. So ये numbering गलत सी है. ठीक है. E लिखा है, that is right. That is D. Nerve to pectineus. That's the correct answer. Artery, vein, and inguinal lymph nodes. They are definitely contents of the femoral triangle. They are also part of the femoral sheath. They are also part of the femoral sheath. Question number 144. Muscle attached to the lateral surface of the greater trochanter. Attached to the lateral surface of the greater trochanter. That attaches to the lateral surface later. I'll just show you an image if you can make out from here. This is what the view of the this is a view of the femur, right? And this here you can make out is the greater trochanter, and this muscle that is inserted on its lateral side is the gluteus medius. The gluteus medius. So 144, the answer as pointed out by Mishti is going to be option 145. Neurovascular bundle of the anterior compartment of the leg passes between the tendons of. So remember we were doing has very nice Tom has very nice dog and pigeon, duck and pigeon. Very simple, just answer based on this. These are the structures that pass through the under the extensor retinaculum. 145. Remember here, this is the neurovascular bundle. You have the vessels here, the vessels, the nerves. So this was extensor hallucis longus, and this was extensor digitorum longus. This was extensor hallucis longus. This was extensor digitorum longus. Neurovascular bundle of the anterior compartment of the leg passes between tendons, extensor hallucis longus, and extensor digitorum. Also related to this fact that upper one third of the leg, middle one third of the leg, and lower one third of the leg. The lower one third of the leg, it passes between tendons of these muscles, right? Tendons of extensor hallucis longus and tendons of extensor digitorum longus, right? Here in the middle one third, it passes between tibialis anterior and extensor hallucis longus. Here it passes between tibialis anterior and extensor digitorum longus. You can see here, that's right, tibialis anterior, hallucis longus, and extensor digitorum. So in the upper one third, it passes between tibialis anterior, extensor digitorum longus, and extensor hallucis. So in the upper one third, it passes between tibialis anterior and extensor digitorum longus. Then next, when it has to pass in the middle one third, it passes between the tibialis anterior and the extensor hallucis longus. When it passes in the lower one third of the leg, it passes between the tendons of the muscles, and it passes between the extensor digitorum longus and the extensor. That is the trend that you can remember, or you can simply remember the Tom has very nice dog, duck and pigeon, right? Question number 146. Line from the mid-inguinal point to the adductor tubercle represents, right? So this is what is being asked here, is the surface marking. Is the surface marking of which artery? The surface marking of a particular artery, and that artery's name is going to be the femoral artery. The artery is the femoral artery. I don't expect you to know the surface marking, but if you read it, so you will realize here that this is the surface marking of the femoral artery. Question number 147. Which of the following is not supplied by the posterior division of the obturator? Which of the following is not supplied by the posterior division of the obturator? Right, so the answer is going to be obturator internus. The answer is obturator internus. Question number 148. Lower end of the femur is ossified from how many primary ossifications? Right? So you have to remember that the lower end has a single primary ossification. The lower end has a single primary ossification. Total कितने होते हैं? There are 5 primary ossification centers. There are a total of 5 primary. Sorry, there are a total of how many centers? There are a total of 5 centers, out of which there is one primary center. There are 4 secondary centers. There are 4 secondary. Just one primary center for the femur, and that is the answer for question number 149. First layer of sole has which muscles? So I already told you, right? Great toe, right? Right little finger, and outside you will write abductor hallucis brevis. Here you will write abductor digiti minimi brevis. In you will write flexor brevis, right? So first layer of sole will have, you can see here, abductor hallucis brevis. Answer is abductor hallucis 149. I told you the entire trick to remember all the muscles of all the layers of the sole. Okay, and I also told you how to remember each of the nerve supplies. So if you haven't seen that, please go to the previous video and please do watch that. वो सबसे important part है. मैंने जितनी भी क्लास ली है लोअर लिम्ब पे, 3 क्लास ली है लोअर लिम्ब पे, important चीज. Question number 150. Myalgia peristaltica is due to entrapment of which nerve? Is the entrapment of the nerve in these. A. Mishti has given the right answer for 149 also. Last answer that I expect from you is for myalgia peristaltica, and then that is the last question that we'll be just ending this session. And I'll be seeing you next month. So next month I have to take 16 hours on you. So I'll be taking some MCQ Marathon sessions there. And next month I'm also going to be teaching on Plus, guys, and I'm also be going to having some classes. So do download the Unacademy learning app. My username on Unacademy is @Chetanya Mittal 5458. मेरा Unacademy पे यूजर नेम चतन्या मित्तल सर्च करो. आंसर इज लैटरल क्यूटेरियस नर्व ऑफ द थाई. एब्सोल्युटली. स्पाइनल लिगामेंट ये रहा. स्पाइनल लिगामेंट के अंदर ये नर्व कंप्रेस हो जाती है एंड दैट लीड्स टू pain and loss of sensation in this affected area, right? The lateral side of the thigh region. So thank you so much for watching. That was all of my classes for October. And do hit the like button. Please don't forget to hit the like button. Please इतना कर दो मेरे लिए. And if you can, just अभी stream खत्म हो जाएगी. Please एक comment drop कर देना. Nice class. That's it. Nothing much. And do subscribe to the channel Let's Crack NEET PG. And hit the bell icon so that you know that which educator is live when. And you can watch according to your own convenience. Telegram channel @NEET PG Chetanya, right? And you can contact me there in the discussion group. You can put your doubts, put your queries regarding a plus or iconic subscription for yourself or for any of your family members, right? And then my Instagram is @Chetanya.blue. Follow me there and you can also send me a message request, which I'll accept if it is about a plus. And right, my referral code is Chetanya10, and I told you that you get a 10% off. I'll tell you how to apply credit, and you will also get a cashback from my end to contact me. Okay, ताकि पता तो चले आपने लिया है. Do this, and you have to be a new user for that, right? A new user to use. Alright, that's about this class. Thank you so much for watching.